is not a single family in the country who has not experienced the need of home health care. If you provide the similar care at home, the cost is just a fraction of what it would be in a hospital. So I have realized that in India we do not have a very organized kind of home health care setup.
We are in conversation with Dr. Sujata Malik, who is the CEO and MD at Sunburst Healthcare. Ma'am, there is a trend which is slowly picking up of end-to-end healthcare service providers across the country. So, can you tell us a little bit about what are the kind of patients that require these home healthcare services, especially, diabetics, cancer patients? Yeah, ma'am.
So, I have been part of the traditional healthcare system for a long time. I have managed large hospitals. While doing so, I have realized that in India we do not have a very organized kind of home healthcare setup, and that is the reason this prompted me to therefore set up this company, which would be an end-to-end provider of all home healthcare services. Whether it is a nurse or an attendant, or a doctor, or a nutritionist, psychologist, what have you, a laboratory, ECG, X-ray. So we have tried to cover all the requirements of patients, which are healthcare requirements at home. And this is what we have been doing for the last 6 years.
So how many patients have now on board?
So at any given time, it is, you could say about 100 patients are under our care, in various parts, not only of Pune, also in Bombay, sometimes in rest of Maharashtra, sometimes other metros also like Bangalore and Chennai, and we have been providing care, wherever we have been able to. And so basically, why the need for home health care?
Yeah.
The demographics of the population are changing. Healthcare is changing actually very rapidly. People are actually living longer. Therefore, they are now having lifestyle diseases, long-term illnesses have become more and more common. There is not a single family in the country who has not experienced the need of home healthcare. Therefore, it becomes imperative that you have to have a system which provides good, scientific, seamless home healthcare.
So it's just not about setting up an ICU-like setup, but it could be just any
Anything,
doctor being sent for an injection or.
The needs of different patients will be different.
What about cancer patients? Can you take chemotherapy at home?
So not all chemotherapy can be done at home. Yet there are some components of chemotherapy, some types of procedures which can be done at home. Yes, they have to always be under the guidance of an oncologist.
Right.
Always professionals who are specifically qualified to administer such medications have to be there. But it is possible.
Okay.
In fact, there are many people who have now stepped into the realm of chemotherapy on wheels, to bring down the cost. It can be done. Only thing is that there has to be proper controls which have to be set up.
So of course, not going to the hospital and taking leave and all that, that helps when you're at home, especially for people who work from home, etc. But how cost-wise, how affordable is this?
So, you just compare the cost. If a patient is staying in hospital, what is the average cost per day in an average hospital? If you provide the similar care at home, the cost is just a fraction of what it would be in a hospital. So I am not saying that there is no cost involved. The costs over a period of time may be significant. There is no question, but still, if compared to cost in a hospital, it is much lower. And then the comfort of being in your home. Your family members do not have to take leave to commute to hospitals. So there is definitely an advantage to being to using home healthcare services, and therefore there have to be providers who can provide it in a scientific, systematic, organized way.
Are there more players in
There
this
are, there are.
field? Do you see
There
it
are, and more people are joining, coming up with different services, and so some of them are only providing part of the services, but there are more and more players which are now stepping into